Our skin, that incredible protective tapestry that covers us from head to toe, is far more than just a surface. It's a dynamic, living canvas, constantly engaged in a silent conversation, subtly mirroring the intricate symphony of biological processes unfolding within our bodies. Sometimes those shifts we notice, a new patch, a persistent bump, a change in texture or color, aren't merely cosmetic concerns. They are vital messages, profound whispers from our internal systems, gently guiding us to pay closer attention, to truly listen. Today, we're embarking on a journey to uncover 10 compelling skin signs that might just be hinting at something significant: a predisposition to diabetes, persistently elevated blood sugar, or the often underestimated challenge of insulin resistance. These aren't just surface-level observations. They are powerful invitations to delve deeper and understand what your body is striving to communicate. Let's begin with one of the most common yet frequently misunderstood indicators: those mysterious dark patches on the skin, a condition medically known as acanthosis nigricans. You'll typically find these telltale areas where your skin naturally folds and creases, most often on the back of your neck, deep within your armpits, your groin, or sometimes under the breasts or even on knuckles. These patches feel distinctly thickened, almost velvety or rough to the touch, and their color can range from a light brownish hue to a deeper, almost grayish black. What's truly fascinating here is the underlying mechanism. When your body becomes resistant to insulin, it attempts to compensate by producing even more of this hormone. This excess insulin, in its role as a potent growth-promoting factor, then stimulates the rapid proliferation of skin cells, particularly in these friction-prone areas, leading to the formation of these distinct darkened regions. While acanthosis nigricans can occasionally be associated with other conditions, its appearance is a very strong and widely recognized signal to consider the possibility of underlying insulin resistance or elevated blood sugar, often preceding a formal diagnosis of type 2 diabetes by years. It truly serves as an early visual warning system, inviting a deeper look into your metabolic health. Following that, we encounter more pronounced and often inflamed skin patches, known as necrobiosis lipoidica. These are visually striking, typically presenting as yellowish, reddish-brown, or even waxy-looking plaques, most commonly appearing on the shins. These patches can have a somewhat atrophic or sunken center, sometimes with visible tiny blood vessels around the edges, and can unfortunately sometimes break down into ulcers. Fortunately, they are quite rare, which makes their appearance even more significant. The name itself, dying tissue that looks like fat, offers a glimpse into the underlying pathology where collagen and fat cells deep beneath the skin surface are undergoing degenerative changes. What makes this condition particularly intriguing is its strong association with an autoimmune component, a factor that makes it more frequently observed in individuals with type 1 diabetes, where the immune system mistakenly attacks insulin-producing cells. However, it can also manifest in those with type 2 diabetes. The development of these patches underscores a complex interplay between the immune system, the integrity of tiny blood vessels, and systemic metabolic health. Now let's explore a topic that often sparks lively discussion: male pattern baldness. It's tempting to dismiss hair loss as merely a sign of aging or an unfortunate genetic lottery, and indeed, genetic predisposition plays the most predominant role. The primary biological culprit for male pattern baldness is a powerful byproduct of testosterone called dihydrotestosterone, or DHT. The real key isn't just how much DHT you have circulating in your system, but rather the inherent sensitivity of your hair follicles to this hormone, and this sensitivity is largely dictated by genes found on your X chromosome. Since men inherit one X and one Y chromosome, if that X carries a particular genetic predisposition for follicle sensitivity to DHT, there's effectively no backup chromosome to compensate. This is precisely why it's aptly termed male pattern baldness, as it's far less common in women. However, the story for women is a bit different. If a woman experiences insulin resistance, her body might convert more of her estrogen into testosterone. This resulting increase in testosterone and subsequently DHT can contribute to a pattern of hair thinning or more diffuse hair loss in women, often mirroring a male pattern on the scalp or causing excess facial body hair. So while genetics predominantly chart the course for men, a woman's metabolic health can indeed play a supporting role in hair changes, underscoring the delicate dance of hormones within our systems and the pervasive reach of insulin's influence. Our fourth significant sign brings us to hidradenitis suppurativa, a somewhat challenging medical term that essentially describes a chronic inflammatory condition affecting sweat glands. This often debilitating condition manifests as deep, painful nodules, abscesses, and even interconnected tunnels, called sinus tracts, under the skin, especially in areas where skin rubs together, like the armpits, groin, under the breasts, on the buttocks, and inner thighs. Sometimes referred to as acne inversa, these lesions are often recurrent, intensely uncomfortable, and can lead to significant pain, chronic drainage, scarring, and a substantial impact on one's quality of life. While the exact cause is complex and involves blocked hair follicles, inflammation, and immune dysregulation, there's a well-documented and strong connection to systemic inflammation, obesity, and metabolic syndrome, which includes insulin resistance. This association suggests that improving overall metabolic health, reducing systemic inflammation through diet, and managing body weight can be vital strategies in alleviating symptoms and potentially mitigating the progression of this challenging skin condition. Next, we encounter blisters, specifically those referred to as bullosis diabeticorum or diabetic bullae. These are fluid-filled blisters that can emerge suddenly on the skin, most commonly on the hands, feet, lower legs, or forearms, often without any prior injury or obvious trauma. They are typically characterized by being painless, not itchy, and filled with clear, sterile fluid, sometimes appearing as symmetrical clusters on both sides of the body. While they usually resolve and heal on their own within a few weeks without scarring, their unexpected appearance is a powerful signal. Medical insights, supported by extensive clinical research, indicate these blisters are more commonly seen in individuals with long-standing or poorly controlled diabetes. The underlying reasons are multifaceted, often stemming from a combination of factors commonly found in diabetes: nerve damage, neuropathy, which can alter skin integrity and sensation, microvascular changes affecting the tiny blood vessels that nourish the skin, impairing its resilience, and a reduced capacity for the skin to repair itself effectively due to persistently high blood sugar levels. It's here that the distinction between merely managing a condition and actively pursuing reversal becomes critically clear. In many conventional approaches, managing diabetes often implies relying on medications to keep blood sugar numbers within a target range. However, for type 2 diabetes, a more profound and truly liberating shift is often possible: reversal. This isn't merely about controlling symptoms, but about implementing significant foundational dietary and lifestyle changes that empower the body to restore its natural metabolic functions, ideally moving beyond the chronic need for medication. The sixth significant sign takes us to skin tags, those small, soft, benign growths that commonly protrude from the skin, appearing like tiny flaps or bumps. You'll most often find them around the eyes, on the neck, in the armpits, under the breasts, or in the groin, areas prone to constant friction. While completely harmless in themselves and typically painless, their widespread presence has a very strong and well-established link to insulin resistance and elevated blood glucose. Consider insulin as a potent growth-promoting hormone. When insulin levels are consistently high due to cellular resistance, it overstimulates the growth of skin cells, particularly in these friction-prone areas, leading to the formation of these characteristic tags. If you find yourself developing numerous skin tags, or if they seem to proliferate, it's a compelling reason to examine your metabolic health more closely. While they can be easily removed by a dermatologist for cosmetic reasons, addressing and improving insulin sensitivity through dietary and lifestyle interventions often leads to a significant reduction in new tag formation, and existing ones may even become less prominent or resolve over time. Moving on to rosacea, a widely recognized chronic skin condition characterized by persistent facial redness, often accompanied by visible blood vessels and sometimes small, red, pus-filled bumps. It's frequently mistaken for adult acne or even eczema due to its varied presentation, but its underlying mechanisms are distinct. Rosacea is fundamentally a condition rooted in chronic inflammation and altered vascular responses, meaning the blood vessels near the skin surface become overactive. It's often exacerbated by specific triggers like heat, spicy foods, alcohol, caffeine, and stress. Given that metabolic dysfunction and insulin resistance contribute significantly to systemic inflammation throughout the body, it's not surprising to see rosacea flaring up or being more prevalent in individuals who are also grappling with underlying metabolic challenges. Furthermore, emerging research highlights the intricate connection between gut health and skin conditions. An unhealthy or imbalanced gut microbiome, often influenced by poor dietary choices common in insulin resistance, can contribute to systemic inflammation that then manifests on the skin. This makes rosacea another important reminder that the health and appearance of our skin are deeply intertwined with our internal inflammatory status and overall physiological balance. Eighth on our list are xanthelasma, those distinctive yellowish, scaly, and often slightly raised patches. The name, derived from Greek, literally means yellow plate, perfectly describing their appearance. These are essentially benign cholesterol deposits that typically form on the eyelids, often near the inner corners close to the nose, and can appear symmetrically on both eyes. While the patches themselves are harmless, not painful, and don't directly pose a threat, their presence is a powerful visual indicator of dyslipidemia, an imbalance of lipids like cholesterol and triglycerides in your blood. This lipid imbalance is a hallmark of insulin resistance, metabolic syndrome, and often indicates a propensity for altered fat metabolism. It's not simply about having high cholesterol in isolation, it's about your body's inability to properly process and clear these fats from your bloodstream, often due to the persistent effects of high insulin and disrupted metabolic pathways. This makes xanthelasma a significant signal, urging you to investigate your metabolic and cardiovascular health more thoroughly, as it can indicate an increased risk for heart disease. While they can be cosmetically removed by a doctor, they will likely recur if the underlying lipid issues are not fundamentally addressed through diet and lifestyle. The penultimate sign is acne, specifically acne vulgaris, the common skin condition characterized by pimples, blackheads, whiteheads, and sometimes deeper cysts. While primarily associated with the hormonal surges of adolescence, persistent acne into adulthood, particularly around the jawline, chin, and back, can be a clear signal of underlying systemic issues. Even if teenagers aren't typically insulin resistant in the classic sense, their consumption of high sugar and highly processed foods, unfortunately so common in modern diets, can significantly contribute to breakouts. Research consistently shows how high glycemic diets trigger a robust insulin response. This, in turn, can stimulate the production of certain hormones like IGF-1, insulin-like growth factor 1, which then increases androgen hormones and leads to increased sebum, oil production in the skin's pores. This cascade creates an environment ripe for inflammation, bacterial growth, and clogged pores, ultimately contributing to acne. So, while adult acne might not instantly scream diabetes, its presence is certainly waving a flag about dietary choices impacting hormonal balance and systemic inflammation, which are foundational components of metabolic health. Finally, we arrive at ulcers, specifically non-healing open wounds on the skin. This is perhaps one of the most critical and concerning skin signs related to diabetes, often considered a strong indicator of advanced metabolic dysfunction. Diabetic ulcers, particularly those affecting the feet, known as diabetic foot ulcers, are a major health concern due to their potential to lead to severe infections, and in unfortunate and extreme cases, even amputation. These wounds struggle to heal because of a complex interplay of factors commonly found in long-standing diabetes. Firstly, nerve damage, neuropathy, often diminishes sensation, allowing minor cuts, blisters, or pressure sores to go unnoticed and untreated. Secondly, poor circulation, peripheral artery disease, severely restricts blood flow to the extremities and thus the delivery of vital oxygen, nutrients, and immune cells necessary for tissue repair and fighting infection. And thirdly, a compromised immune system further hinders the body's ability to effectively fight off infection and repair damaged tissue. When you hear advice on preventing diabetic ulcers, it rightly includes diligent blood sugar control, regular exercise, smoking cessation, weight management, and meticulous daily foot inspection. However, it's profoundly important to question why the fundamental role of drastically reducing sugar and carbohydrate intake, the very drivers of high insulin and the progressive development of diabetes, is often understated. Truly reversing diabetes, rather than merely controlling blood sugar with medication, means adopting comprehensive, sustainable lifestyle changes that empower your body to restore its natural metabolic functions, leading to improved circulation, nerve health, and immune response, ultimately fostering genuine healing from within. Recognizing these diverse skin signs is a profoundly empowering first step, but what truly matters is what you do with this newfound knowledge. Think about it. Most of us are incredibly diligent about the upkeep of our cars. We service the car before it breaks down, opting for a preventative oil change over a costly engine replacement. So why do we often wait for our own bodies to shout with severe symptoms, only acting when things have already significantly deteriorated? Don't wait until the engine seizes. Listen to the subtle knocks and pings your body is giving you right now. One of the most powerful and proactive ways to take charge is to truly understand your key blood markers. When your doctor orders blood tests, or if you choose to get them yourself, look beyond just the official reference ranges, which are often set for a broad population, not necessarily an optimally healthy one. For example, aim for a hemoglobin A1C below 5.3%. While 5.7% is often the official threshold for prediabetes, anything above 5.3% indicates a subtle upward shift in your average blood sugar over the past few months, a gentle warning that you're heading in the wrong direction. For fasting insulin, strive for a number under 5. The official lab range might generously say anything under 25 is fine, but a number like 24 means your pancreas is working incredibly hard, producing vast amounts of insulin just to keep your blood sugar in check, essentially struggling for decades before a formal diagnosis of type 2 diabetes even occurs. Ideally, you want your triglycerides to be under 100 mg/dL. Higher numbers are a strong indicator that your cells are resisting the uptake of fats from your blood, a classic sign of insulin resistance. And finally, consider your VLDL, or very low-density lipoprotein, sometimes referred to as remnant cholesterol. This marker, ideally below 20 mg/dL, gives you even more nuanced insight into how your body is handling triglycerides and transporting fats through your bloodstream, often correlating with insulin sensitivity. These numbers aren't just arbitrary figures. They are detailed, objective reports from your internal systems, telling you precisely where you stand on the spectrum of metabolic health, allowing you to make informed choices long before significant problems arise. The truly encouraging news in all of this is that for nearly all cases of type 2 diabetes, and certainly for insulin resistance, reversal is not only possible, but often profoundly achievable through dedicated, sustained lifestyle shifts. This isn't about quick fixes, harsh deprivation, or complicated schemes, but about allowing your body to reconnect with its natural metabolic wisdom. There are various effective eating styles to explore, and the best one for you is the one you can sustain. A paleo approach, for instance, focuses on eating more like our ancestors, thoughtfully cutting out processed foods, most grains, and often dairy, thereby eliminating a vast amount of rapidly absorbed carbohydrates. If you need to tighten things up further, a low-carb, high-fat approach might involve consciously tracking carbohydrates and prioritizing healthy fats, quality proteins, and plenty of non-starchy vegetables. Taking it a significant step further, a ketogenic diet reduces carbohydrates to very low levels, encouraging your body to shift into a metabolic state called ketosis, where it efficiently burns fat for fuel instead of glucose. For those with particularly stubborn metabolic issues or who strongly suspect food sensitivities and allergies are at play, options like a ketovore diet, which is mostly meat with some carefully chosen non-starchy vegetables, or a full carnivore diet comprised solely of animal products, can serve as powerful elimination strategies. It's worth noting that while a carnivore diet is zero carb, consuming protein can still stimulate some insulin response. So many of its benefits often stem from its role as the ultimate elimination diet, removing potential allergens that contribute to systemic inflammation and gut dysfunction. Similarly, an autoimmune paleo (AIP) diet builds on the paleo framework by further eliminating common allergens like nightshades, eggs, nuts, and seeds, proving highly beneficial for many seeking to quell inflammation. All these strategies share a common thread. They dramatically reduce the metabolic load, stabilize blood sugar levels, and enhance insulin sensitivity, allowing your body to heal, adapt, and return to a more balanced state. As we conclude this exploration of your skin's profound messages, remember those initial images: the dark patches, the inflamed lesions, the persistent skin tags, and especially the grave non-healing wounds. These aren't just visual curiosities or superficial blemishes. They are urgent calls to action, invitations to a deeper, more compassionate conversation with your own body. If you found this discussion illuminating and genuinely helpful, we would be so grateful if you'd consider giving this video a gentle thumbs up. Sharing it with anyone who might find this information valuable helps us reach more people who deserve to feel empowered and informed in their health journey. And if you're keen to continue uncovering the incredible secrets of how your body truly works and how you can nurture it back to vibrant health and sustained well-being, we warmly invite you to subscribe and perhaps leave a comment below with your thoughts or experiences. Your well-being is precious, irreplaceable, and understanding these vital signals is a powerful, loving step towards taking compassionate, informed control of your most invaluable asset, your health.